Hi, I'm Dr. Julie Steinauer, and in the segment of Ask Dr. Julie, we get a great question that came in from multiple sources online. How successful is Syntonics light therapy? Well, I have a bunch of filters right here. Da, 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 da. That's just a couple, but I have a bunch of these on my desk. There are tons of different Syntonics or light therapy filters, and we don't believe as a clinic and as a doctor, I don't believe in just using what's called standalone Syntonics, which means that I don't think that prescribing only Syntonics is the best method, at least for my mode of practice. So we're going to combine Syntonics with a vision therapy course of treatment, which means that we're generally going to ask people what's going on with your vision, and we're going to evaluate them to find out what it is that's happening with their vision and how we can help them. So I've been using a light therapy for approximately 10 years as a clinician. I've been a doctor for 19 years, whoa. But a good portion of my time then, half of my time or better, has been using Syntonic light therapy. And I wouldn't see any patients without it these days. I do believe that it definitely enhances the program, and it's really, in many cases, the thing that's kind of the most important part of the therapy program. Like, we can't do it without Syntonic light therapy. I mean, we could, but our results wouldn't be as good. So do we have any cases of like failed stories with Syntonics? No, not really. There are many things that we're trying to achieve with Syntonics. So it might be that we're trying to open up a visual field. Maybe we're trying to restore a field if someone had a stroke or lost vision. Maybe what we're trying to do is say, signal the muscles to align the eyes better. Maybe what we're trying to do is improve binocularity. Maybe what we're trying to do is reduce a lens prescription. Maybe what we're trying to do is turn on an amblyopic eye. So we're up to like 6 different. There's so many things that you can do with Syntonic light therapy. Again, I wouldn't really treat anyone these days without it. So is it 100% successful? Well, I suppose it depends on who you talk to and who does it, because some clinics, they only do standalone Syntonics, and some clinics just believe that it's kind of a small fraction of their practice and they do a lot of other things. Or maybe they dabble in it and it's not really the thing that they do most often in their practice and they're not as comfortable. So I can't speak for everyone else in the world who uses it. I can only speak for me. But as for me and as for our clinic, we really wouldn't go without utilizing it. It's so powerful and it has such an amazing result for all of our patients. It's widely successful. So we just use it for every single patient encounter that we can. And again, I wouldn't really practice without it. So for the multiple people who ask this, and they ask this question regularly, we thank you for it. I hope this is somewhat of an answer for you that satisfies what you're looking for. Now, if you're seeing this on YouTube, clearly you're probably a follower of us, but if you're not, then just click and follow this, hit the subscribe button so you can follow us here. If you're catching this in our email system and maybe you haven't followed us on YouTube yet, well then go ahead and follow us. And if you're wondering, hey, could this stuff work for me? Well, then contact our clinic. If you happen to be local, call us at 618-288-1489, or obviously you can go to our website at visionforlifeworks.com and you can fill out information for us there. What will happen is it will kick over to us, and then we'll be able to connect with you to find out how we might be able to help you, and maybe help you, obviously, with Syntonic light therapy goggles, which we use for everybody. All right, with that, I'm going to say thanks for tuning in, and stay tuned for more segments of Ask Dr. Julie.